Hello, and welcome to this course on colorectal cancer screening. This three-part training will highlight the importance of colorectal cancer screening, give an overview of different screening options, and describe strategies for clinics to increase colorectal cancer screening rates. This is an effort to improve screening rates and decrease the burden of colorectal cancer in Idaho. Colorectal cancer is the second leading cause of cancer death among men and women in Idaho, yet it can be prevented with early screenings. Each year in Idaho, more than 600 people are diagnosed with colorectal cancer, and each year more than 200 people die from the disease. Only 55% of people will survive at least 5 years after a diagnosis. Screening plays a crucial role to reduce the burden of this disease within our state. However, only 61% of Idahoans aged 50 to 75 report completing a colorectal cancer screening. This ranks Idaho 44th in the nation for colorectal cancer screenings. In other words, a lot of people who should be getting screened are not getting screened. Screening and early detection are vital to colorectal cancer prevention and outcome improvement.
Having a case of advanced colorectal cancer is one of the most devastating things that can happen to a patient or family. So as a medical oncologist specializing in GI oncology, unfortunately I see these patients every day in my practice, and I see the effects on them and their lives and their family. So I say this to you to impress upon you the importance of colorectal cancer screening, because these are all preventable cancers. These are preventable deaths. And so we always urge our colleagues, our loved ones, members of the community to do colorectal cancer screening in order to prevent these tragic cases from happening.
The U.S. Preventive Services Task Force recommends that both males and females at average risk complete colorectal cancer screening starting at age 50 and continue until age 75. Individuals with a family history of colorectal cancer may be screened prior to age 50. The risks and benefits of different screening methods vary, but the best test is the test that gets done.
It's critical that we start talking to our patients about colorectal cancer screening early. There's a lot of misconceptions about how hard or how grody a screening test for colorectal cancer can be. And these are some of the barriers that we have to overcome as clinicians in really keeping our patients safe and helping to prevent and screen cancer. We all know that there's some things that go into the prep for colorectal cancer screening. We know that patients come into our offices and are sometimes embarrassed or squeamish about undergoing these types of tests. And my recommendation is that we go right at the heart of the matter and explain to our patients that while the test may be a little bit cumbersome, may involve some increase in our bodily functions, and may cause us some embarrassment, this is nothing compared to having advanced cancer that can be prevented. And because colorectal cancer, when it prevents an advanced or metastatic stage, is something I can treat, and I do every day in my clinic, I'm always thinking I wish that this patient had had screening, had been aware, had been educated, and that you are a critical part in making this happen.
The most powerful factor that determines whether an individual gets screened is whether it was recommended to them by their doctor. Some of your patients may not know that there are screenings to detect colorectal cancer early. Some of your patients may not even know what colorectal cancer is. Screening rates vary by race and ethnicity. The Behavioral Risk Factor Surveillance System, the nation's system of health-related telephone surveys that collect state data for more than 400,000 U.S. adult residents regarding their health-related risk behaviors, chronic health conditions, and use of preventive services, shows that in Idaho, 62% of non-Hispanic whites are getting screened for colorectal cancer versus only 49% of Hispanics. Indian Health Services tracks data of health services provided to members of federally recognized tribes. This data shows that just 36% of American Indians and Alaska Natives in Idaho have completed a colorectal cancer screening. Compared to the non-Hispanic white population in Idaho, American Indians and Alaska Natives have higher incidence rates and higher mortality rates of colorectal cancer. Overall, Idaho has the opportunity to increase screening rates. This is especially true among disparate populations.
Colorectal cancer is a priority here in Idaho. It's one of the few cancers that we can actually screen for and detect early. By By doing this, we can remove polyps before they turn into cancer.
Our goal is to reach 80% screening, and in doing that, we can really see a decrease in mortality and the impact of colorectal cancer here in Idaho. Patients face many barriers to screening. Your role as healthcare providers is to help address both real and perceived barriers that patients face.
As someone who sees patients with advanced colorectal cancer, I often hear patients talk about some of the barriers or some of the ideas that they had about colorectal cancer screening that unfortunately prevented them to get screening in the first place.
The most powerful factor that determines whether an individual gets screened is whether it was recommended to them by their doctor. It probably doesn't come as a surprise that cost is a major barrier for patients. Make sure patients are aware that colorectal cancer screening should be covered by insurance. And don't forget that more affordable, at-home screening tests are also an option. Patients should also be aware that colorectal cancer may be present without symptoms. The goal is to screen patients even before they report symptoms. When there's no family history of colorectal cancer, individuals may lack a sense of urgency around the issue. Patients may view colorectal cancer screenings as uncomfortable or embarrassing. Your role as a healthcare provider is to address both real and perceived fears your patients may be facing. If you do not recommend a screening directly, or if the patient has other pressing health concerns, say high cholesterol or an injury, preventive services may fall by the wayside. However, it is your role to elevate the importance of prevention and recommend colorectal cancer screening for eligible patients.
For me, I've always thought that these are not barriers. These are really just inconveniences, perhaps misperceptions. But I wouldn't stake my life on an inconvenience. This is an entirely preventable cancer, and I urge you to discuss and educate your patients about the value of screening for colorectal cancer. This is about getting a life-saving test done. And so I have to recommend that everybody who's over the age of 50 or who has a family history, as I did, get colorectal cancer screening done at the appropriate age and that you talk to your patients about it.
Many of these barriers can be addressed with specific and concise patient education and communication. The National Colorectal Cancer Roundtable, in partnership with the American Cancer Society and the Centers for Disease Control and Prevention, conducted market research and developed 4 key messages to address common barriers and motivate the unscreened. The first message is, there are several screening options available, including simple take-home options. Talk to your doctor about getting screened. This message suggests affordable options while addressing fears associated with standard procedures and prep. The second message is, colon cancer is the second leading cause of cancer death in the U.S. when men and women are combined, yet it can be prevented or detected at an early stage. This message challenges the assumption that colorectal cancer can't or won't happen to them, especially for those who do not have a family history of colorectal cancer or for individuals who are not experiencing symptoms. It also educates patients that early detection means there is an opportunity to fix problems and prevent future issues. The third message is, preventing colon cancer or finding it early doesn't have to be expensive. There are simple, affordable tests available. Get screened. Call your doctor today. This message addresses affordability of screening and encourages patients to take control of their health. The last message is uniquely appealing for the newly insured. Most health insurance plans cover life-saving preventive tests. Use the health benefits you are paying for to get screened for colon cancer. Call your doctor today. This further empowers patients who are optimistic about their health with access to new services they may not have had before. It also addresses concerns about affordability. All messages should end with a call to action to get screened. These messages may be used in digital or print patient reminders, but they can also be useful when talking to patients in the office when you have the greatest opportunity to motivate a patient to get screened.
A lot of times patients feel that there's only one way, or they only know of one way, to screen for colorectal cancer, and that's the colonoscopy. I let patients know that if it's possible, a colonoscopy is a great option for them. However, I also let them know about the FIT test, that is the take-home test that can be a low-cost test performed in the comforts of their own home, that for relatively low investment can get a great return on it in regards to their preventive care.
Join the National Colorectal Cancer Roundtable as well as the Idaho Colorectal Cancer Roundtable to increase Idaho's screening rate from 61% to 80%. Not communicating the importance of screenings could be detrimental to your patients, so keep this topic on the forefront of patient discussions. Idaho can do much better than 44th in the nation for colorectal cancer screening.
The National Colorectal Cancer Roundtable is a group of organizations headed by the Center for Disease Control and the American Cancer Society, who are collectively working towards reaching a 80% screening rate for our nation's eligible patient population, so those adults age 50 to 75. By increasing our colorectal cancer screening rates, we can effectively decrease colorectal cancer incident rates and mortality among Idahoans, which is where the Idaho Colorectal Cancer Roundtable is taking initiatives and resources from the National Colorectal Cancer Roundtable and mirroring them for Idaho's healthcare landscape and our patients right here. So helping our clinics and our systems throughout the state, whether they're in metro markets or rural areas, identify what they can be doing to decrease obstacles or barriers for patients to get their colorectal cancer screening. And our hope is that we as a state will reach an 80% screening rate by the year 2018 or shortly thereafter.
The next time a screening eligible patient is in your office, recommend colorectal cancer screening along with other preventive services. The goal is to screen 80% of Idahoans age 50 to 75. If we can accomplish that goal, then we can prevent more than 11,000 new cases of colorectal cancer and more than 8,000 deaths in the next 12 years. Thank you for joining us for Part 1 of the Colorectal Cancer Screening course. Join us for Part 2 to receive an overview of different screening options, highlighting both at-home tests and the traditional colonoscopy.